Hey everyone, it's Stephanie Rose. Some of you know me with the Fit and Fab Mama. If you know anything about me, I have PCOS. I am a big advocate for PCOS. A lot of people don't know much about it, and I love when I get news to share it with people so they can take the news to their doctor and get checked out. The big thing with PCOS is infertility, and not only infertility but weight gain and just weight that we can't get off. So, as you might have known, I beat the infertility portion of it. I have four beautiful children. Their ages are 13, 11, 4, and 2. I have had one miscarriage, and to me, that's a win in my book. Four beautiful children. When I was told at the age of 24 I would have none, and no one knew how to deal with me. So I'm going to go a little bit through my story, but I want to get to this year and what I found out this year. At age 24, I was diagnosed with polycystic ovarian syndrome. Told I was never having children, but they put me on metformin anyway. About 6 months later, I was pregnant with my first child, and ecstatic to be pregnant since I was told I would never be pregnant. I've learned a lot through each pregnancy. I've learned a lot through the last 15 years of having it and being diagnosed with it. From crazy cycles to metformin to what you need to eat to control it, how to exercise, just a lot. But as I came upon this year and the beginning of this year, my daughter hit about 18 months, was not able to lose the rest of this baby weight no matter what I was doing. I was eating clean. I was working out 6 times a week. I'm helping coach other people. They're losing weight. I'm not losing weight. Mad. I was mad. I was mad at PCOS. I was just mad. But you know what? Instead of getting mad, I just started to get answers. So I went back to my doctor, my OBGYN, who always has me on metformin. And I had been done nursing my daughter, so he put me back on metformin, 1,500 milligrams. And I said, I don't know if I need this anymore. Can we test me to see if I really need to have metformin? He was like, nope, you're polycystic, you're pre-diabetic, you're always going to need metformin, and one day you're probably going to be diabetic. You're probably going to have type 2 diabetes. So just be prepared, just learn how to deal with the medicine, and go on your way. Wasn't happy with the answer. Not at all. So I went to an endocrinologist who, of course, does blood work, and she looked at my thyroid, she looked at some of my hormones. I thought she did a thorough blood test panel. She didn't. She found out my cortisol was reversed and I was vitamin D deficient. And she said, well, if the metformin's not working, maybe you need to go on 2,000 milligrams. And I said, well, who even says I need to be on metformin? Is anybody even checking my insulin? I went to an endocrinologist and she didn't even check my insulin. Bad news. That doctor's out too. So I went to another OBGYN recommended by a friend. And this one took time to sit with me and listen to my concerns and my thoughts. And I was like, can you please take me off metformin and test me in a couple months and let me see what my blood sugars are without metformin and just let me know where I need to go, how many milligrams I need to be on. Maybe not 1,500, maybe 500. Just give me some answers. So she did. Took me off of it for 8 weeks, came back, found out my testosterone was low, which was puzzling. Testosterone low? Did you know I was polycystic? I mean, hello. Polycystic has high testosterone. That's why you don't cycle. That's why you don't ovulate, because your egg is fighting to get out because it's fighting this testosterone. So what's going on? She said, well, guess what? You're not insulin resistant anymore either. You no longer need metformin. What? I've been insulin resistant forever. Okay, now explain why I can't lose weight. She said, whatever you're doing, keep doing it, and we'll deal with the testosterone. Okay. So I continued doing what I was doing, eating clean, weight was not coming off. And I was just disappointed and mad and angry and started hating myself again, hating the way I looked, hating the way people would ask if I'm expecting again because I'm holding weight in my belly, hating my double chin, hating how, if you can see, how I carry weight through here, just hating it. So a friend recommended a hormone doctor to me that specializes in PCOS, and I went. Booked an appointment and had to wait 6 weeks to talk to her. 6 long weeks. But guess what? I talked to her, and she was amazing. Ran all kinds of tests on me and really nailed down what is going on. And guess what? Today I got answers. Today I got me some answers. So I just want to go over the answers I got and the tests that she went. I got me some notes. So you could go to your doctor and ask the same, okay? So I'm going to read. Sorry, I'm not looking at the camera. She tested my glucose, my insulin, my HbA1c. I think that's the way the letters go. I'm not a doctor. I'm just a mom. Got check marks on all 3. She said by looking at that, that's how you really test for polycystic. And I'm no longer insulin resistant. I'm not even pre-diabetic. There's no way I need metformin at this time. Whatever I'm doing in my diet and my exercise, I have reversed my syndrome. Not cured it, reversed it. Now, if I go back to my bad eating habits and not exercising and not taking care of myself, I could have to be on metformin again. But guess what? It is reversed. Look at my lips. Reversed. I reversed it myself through food, real, non-processed food, and exercise. If you want to know how, I can help you how. I can help you learn how to eat and exercise that only takes 30 minutes a day. I can do that, but that's not the point of this right now. Vitamin B12. Woohoo! 888 was my number, people. I used to be vitamin B12 deficient, weekly shots deficient. You know why? Metformin was draining it out of my body, draining it. So be careful if you're on metformin. It will drain your B12. Vitamin D. Woohoo! Not doing good in vitamin D again. So, what's the repercussions of vitamin D? Didn't really know. Let me give them to you. Symptoms, you're tired. Yeah. I thought I was tired because I had 4 kids and I worked full time. No, I'm tired because I have no vitamin D. General aches and pains. I'm always sore through my upper body. Even when I don't work out, I'm sore. So, good to know that these are just not me getting old. Health risk of low vitamin D. Bone pain, muscle weakness, increased risk of cardiovascular disease, osteoporosis, and guess what? The big C, cancer. Cancer. Not happening. I'm on some vitamin D every day, about 300 units. 3,000 units. That's how deficient I am. So have your doctor check your vitamin D. It is important to your health. Okay. Vitamin D also plays a role in prevention and treatment of hypertension, glucose intolerance. Hello, glucose, polycystic. Here we go. And prevention of diabetes. Please, I've got to have some vitamin D. Okay, so then she tested my thyroid, which was my TSH. She also tested T4, T3. Make sure they test T4 and T3. The next test, I don't really know what it is. I think it does with your pituitary. FSH/LH, and that has to do with your pituitary gland. I'm good in all those. No thyroid, and if you have polycystic, sometimes you do have thyroid issues. Perfect. All right, cortisol. Remember my cortisol was reversed at the beginning of the year? I fixed it with food. The way I eat, fixed it. And 2 hormones you need. Testosterone. I wonder how that played out, huh? And progesterone. Oh, that's hard for me to say. Testosterone was low. Yeah. PCOS and low testosterone. And my progesterone, she just called me, low. Which, low progesterone means you have mood changes. Anxiety, nervousness, depression, headaches, migraines, a low sex drive, menstrual problems, including heavy or irregular periods. How much does this correlate with? What's behind me? PCOS. A lot. So, people, get your hormones checked. Get them checked. Low testosterone. What does that cause? Oh, increased body fat, depression, fatigue, dry skin and hair, and hypertension. So guess what? As of today, I just got my phone with my doctor. I'm taking vitamin D supplements and progesterone. She just ordered me progesterone, and I go pick it up in a couple hours. And we are getting this life back on track, people. We are getting this life back on track. Now, it's not a quick fix. No, it's not something I pop a pill and woohoo, I am skinny. No. Guess what this is going to take? Eating clean, exercising, taking my meds, taking my vitamin D. This is going to take hard work, and it's not going to take a 30-day fix. It's going to be 90 days, but I promise you this. I'm going to journal everything that I go through on my blog, video. If you like to see me in video, I'm a little bit crazy. I don't know if you like to see me in video, but pictures. I'll even put it out there in pictures, people. But not because I want to say, look at me. I'm maybe losing some weight and getting my life on track. I want to help you, and I want you to see that if a mom of 4 that just fought so hard to find out about her health can do it, you can too. You can too. I am here for any questions you have. Feel free to leave them on the blog, or if you're watching this on my Fit and Fab Mom page, you can leave them there. If you are not following me on Facebook, I am at facebook.com. I guess that's a / I don't know. Fit and Fab Mama. FITANDFABMOMMA. I will leave it below. You can follow me. Any questions you have, I'm just a real mom. I'm just a real person. I do help people in small accountability groups lose weight, really dig in, show them the meal plans I use, customize them meal plans for stuff they like to eat. The thing about a lifestyle change is you have to like what you're eating. A diet doesn't work because you know what? I don't eat tuna. I don't want to eat tuna. I don't eat salmon. It's not me. Don't make me eat it. Let me eat what I like to eat, but let's put it in a meal plan that works. Yes, you can have some chocolate occasionally. Yes, you can have certain things occasionally, all in moderation. But let's get it done. And then I can also teach you how to do 30-minute quick workouts that I do at home, like in HIIT sessions or just daily workouts. You can follow a program. I have programs you can follow that are 30 minutes. I can't go to the gym. I have 4 kids. I work a full-time job. I have a husband. I have like this much time during my day. So I want to show you what I do, and maybe you can do it. If you have any questions about these tests, I'm going to label them out in my blog so you can ask your doctor about it. Fight for these tests. Fight to have your hormones checked. This is your health, ladies. This is your health. If you're in I live in Atlanta, Georgia. If you're in the Atlanta area, I have doctors I can recommend that have helped me. But fight for this. We're fighters. We were given this syndrome, not disease, this syndrome, because we were strong enough to handle it. And I was given it to help others. It's my passion. It's what I'm going to do. So here we go. We're going to beat this down the next 90 to 120 days. Stay tuned for updates. I promise you updates every Thursday to Saturday, maybe, depending on when I can sit down without crazy kids running around screaming my name. But I'm going to bring you all the information you want. I will post meal plans. If you want my special accountability groups, let me know. I dive into you daily. I coach you daily. It's how I started. It's how I got on this journey after child number 4. So I'm going to cut it because I'm sure you're tired of me just babbling. But I am anxious to hear what you think about this, your thoughts, your comments, anything you have to say. I'm here for you. If you need me, comment below. I will respond, and let's get this. Let's fight this PCOS. I hope you all have a great day, and let's do this. Let's make the rest of 2014 and 2015 the best we can. Bye.